Hi, I'm Dr. Rhett Bosnich and welcome to Newin Institute. Today I'm going to run through with you a brief list of questions that you can ask of your surgeon and the clinic you're attending with regards to hair transplantation surgery to help you make an informed decision as to whether that surgeon and clinic is appropriate for performing your surgery. The first question you need to ask is the person that you're discussing your hair loss with at the initial assessment a medical practitioner or surgeon who is experienced in the treatment of hair loss? Many clinics utilise the services of counsellors or salespeople to perform these initial assessments. It is important to understand that hair loss and all its causes are medical conditions, and it is important that a medical practitioner or hair transplant surgeon performs this initial assessment for you. Preferably, it should be the surgeon who may be performing your surgery that should be completing your assessment. The next question you need to ask is the surgeon an active current member of the International Society of Hair Restoration Surgeons? This society has over 700 active members and is instrumental in ongoing education for all hair transplant surgeons throughout the world. You then need to ask whether your surgeon has attended regular workshops and regular annual conferences held by the International Society of Hair Restoration Surgeons. These are important for the ongoing education of any hair transplant surgeon to enable us to keep abreast of the newest and latest treatments in this field of surgery. Hair transplantation surgery involves a surgeon and the assistance of hair transplant technicians. So the next question you need to ask is how many technicians will be assisting in your surgery? How long have those technicians been working in the field of hair transplantation? What are their particular skills in terms of what types of hair transplant surgery have they performed? How many surgeries have they performed? How many surgeries do they perform per year? And lastly, have they attended conferences and workshops by the International Society of Hair Restoration Surgeons to further their skills as well? I would then recommend you ask your surgeon whether they have sat and passed the American Board of Hair Restoration Surgeons exam. This exam is not compulsory for hair transplantation surgeons, but it is internationally recognised throughout the world. You then need to ask your surgeon how many surgeries do they perform per year. Most full-time hair transplantation surgeons would perform at least 50 surgeries a year as a minimum, up to 400 surgeries per year. And probably the last question that you need to ask of any surgeon and clinic is, are the photos and the videos that they are showing you of patients that they themselves or the surgeon themselves has actually operated on? Many clinics can utilise pre and post photos, but it is important that you ask the surgeon attending whether that is their patient and whether they performed that surgery. This will give you a good indication as to the skill set of that surgeon and that clinic. I believe all of the above questions are very important, and all honest and ethical clinics will answer these questions quite willingly. So, if you should have any further questions about hair transplantation in general, you can contact us at our website, which is www.newininstitute.com.au.